South Africa is facing a critical organ donor shortage, and it's leaving thousands of patients waiting for life-saving transplants. Despite the high demand for things like kidneys, hearts and livers, donation rates remain low. More than 6,500 people are this morning on transplant waiting lists, with more than over 1,100 in Gauteng alone awaiting kidney transplants. The Executive Director of Operations at the Organ Donor Foundation, Samantha Nichols, joins us this morning. Samantha, good morning and welcome to the program. Thank you very much for your time. I think let's just start with familiarizing our viewers who may not know what organ donation is all about and what that world is, with just a description on what it is.
So organ donation is, when we pass away one day, in very specific circumstances, if you've been in a car accident or a traumatic type of death, where you land up in hospital on a ventilator, you can donate your solid organs, your heart, lungs, liver, kidney, and pancreas, and help up to 7 people save their lives. And also donate tissue, skin, bone, corneas, and heart valves can improve the quality of life of up to 50 more individuals.
Wow, and that is so profound, yet we see in South Africa, given some of the numbers we have just shared about so many people on those waiting lists, that the donation rates aren't as high. What is stopping or preventing people from donating?
There are so many factors in South Africa. People use the sort of phrase lack of awareness, and we know that the Organ Donor Foundation has grown 5 times over the past 10 years, and they're more than ever creating awareness. There's articles in the media every single day. We have 3 awareness events throughout the week, every single week throughout the year. So we know that awareness is not the real issue. Education is a big issue. People don't really understand the concept of organ donation. But there's another level or a problem, and that is lack of referrals from hospitals. So doctors and ICU staff who have a potential donor in the units but are not referring them to transplant centers. There's also lack of resources. So there's systemic issues that don't allow actual donors or potential donors getting to the transplant centers or the coordinators being able to discuss the decision with the family. So we call that a roadblock in terms of hospitals not referring potential donors.
The non-referrals that you are talking about now, and this would be a really important opportunity to have those organs then in the system, those potential organs in the system, which leads me to consider, well, first of all, we need some kind of technology, one imagines, or digital technology to be able to help in, creating awareness. This is available right now and connecting them to those who might be in need. But it also is a question around how long organs can stay viable if they are available once somebody passes away.
Absolutely. So the first factor, we actually have an organ donor registry. It is available to transplant coordinators. They can check with someone's ID number if someone's a registered donor, but you don't have to be a registered donor for the family to be asked for consent. So that's the process in South Africa. So every potential brain dead person on a ventilator is a potential donor, and the family should be approached for consent, and they're not being approached, not all of them. The second element you talk about, just refresh my mind, was the viability of organs. So yes, organs are only viable for a certain amount of time. For example, it's called the ischemic time. A heart can only be, or is only viable for 4 to 6 hours. So it needs to be removed, transported to the patient in need, and implanted within 4 to 6 hours. So there is a time frame. Tissue can be used for a longer period after death. So tissue obviously has a longer time frame. I think bone is up to 72 hours after death. So there's always a possibility that either organs or tissue can be used.
You said at the beginning, Samantha, that typically it would be people on, ventilators, and I imagine those would be people with brainstem injuries, where the families might be approached to perhaps turn off those machines, and those could be potential donors. But a donation can also come from a living person. Am I right? Especially when it comes to certain organs like kidneys.
Absolutely. So the highest number of patients on the waiting list are kidneys. We know that 1 in 10 people will suffer from chronic kidney disease in South Africa. There's lifestyle issues. There's all sorts of, so it's a growing problem. And there are many people that don't realize, their family, friends, their community members could get tested, and it's a very safe procedure. It's done weekly at the Chris Barnard Hospital, as an example. I think they do 2 kidney transplants a week. It's the most performed transplant, very safe. And we need more people to come forward to say, yes, I'd like to donate a kidney. You can live an absolutely normal life with 1 kidney.
Before I get to how people can become donors, if they're watching this interview and think, oh my goodness, that's something I didn't think of, I could benefit 7 people and possibly 50 others if I allow access to things like my other tissue, is the messaging itself. And when you encounter people who might be resistant, let's say for religious reasons, Samantha, what kind of messaging is there to win those individuals over, or others who might have some cultural beliefs that don't conform with organ donation?
We find that most religions support organ donation across all religions. So we ask people to speak to their religious leaders or spiritual leaders or cultural leaders. We actually find that we had a few years ago a gathering with many cultural leaders, traditional healers, and they were very much in support of organ donation because many members of their community were suffering from renal failure and needed kidney transplants. So we find at the end of the day, it isn't cultural barriers or religious barriers, it's educational barriers. It's the people not understanding, or the public not understanding how the process works and fears around that. So we ask people to contact us so that we can give you more information and, help them understand the concept of organ donation.
Well, let's go back into that. I mean, I just kind of glanced over to Arabile because I was remembering a conversation that I'd had, I think, a few years ago about this. My information might not be 100%, so I'm just disclaiming that. But where, especially in perhaps in African cultural or traditional religions, the concept of, being buried intact in a way with all of your organs in place is something that seems to be a predominant belief or narrative. When you mentioned just now that, across religions and even including traditional healers, that there is an understanding that this is okay. Just share with us a little bit more about that message.
Right. So the first thing is, for organ donation, there isn't a word in African languages. It translates to body parts, which is already a problematic thing. Yes, there are some beliefs that people would like to be buried with their organs intact, but in the spirit of Ubuntu, that comes first. And we found with discussions with cultural and traditional healers, is that if you can help your fellow man first, that is more important, and that takes priority. So yes, there are some beliefs, but we again go back to education is the key to addressing all these problems.
I think it's a fascinating thread. I think we must bring in someone from the traditional, the traditional leaders, and kind of, again, have that conversation where they're concerned as well, because it is an important one, as you say. So many people in need. One of the highest organs in demand right now in South Africa are kidneys. You also have things like lungs, I believe, which are also in high demand, and liver as well at the moment. Talk to us about how people do become donors, and what are some of the things they should bear in mind when they agree?
It is actually the simplest process. People think that you need to undergo tests. They often confuse us with other related organizations like blood transfusion. It is so simple, and there's no age restriction because the doctors or the medical team will decide at the time of your death. So if you're a smoker or drinker or have a chronic illness, sign up anyway, because the tests will be done at the time of your death, and they'll determine which organs or tissue, and there's always a possibility that they can use something. So you don't need to undergo tests. It costs nothing, it's completely free, and it literally takes a minute of your time. You go onto our website, odf.org.za, sign up there, discuss the decision with your family. You'll receive your electronic information pack with your organ donor card, and that is it. That's the entire process. We will send you more information, like your frequently asked questions, etc. And if anything should happen to you, ask your family to respect your wishes. That's the most important thing.
Bringing in the concept of death, which is something we hardly think about throughout life, but in supporting another person's bid for existence, this is a vital conversation. I want to go then to the end, right? So I've passed away. I've signed up as an organ donor. What can my family expect will happen at the hospital or wherever I'm taken? Say, wherever I die, how will my wishes be fulfilled in terms of me wanting to donate everything that is possibly harvestable and usable?
Absolutely. So if you land up in a hospital, ICU, or trauma unit on a ventilator, and you've been diagnosed brain death is diagnosed by two doctors who are completely independent of the transplant team. There's a series of internationally recognized tests. When all those tests are done and they see that you are a potential donor, they should have the discussion with your family. As I mentioned earlier, it doesn't always happen. If your family can mention or say that my loved one is brain dead, they can contact us. The Organ Donor Foundation will put them in touch with the transplant team if they haven't been approached at that point. But they should be approached by the transplant coordinators who discuss the whole process, ensure that the family understand the concept, and the family have to sign consent at that point to say they're happy to donate the organs or tissue. If you die at home or at the scene of an accident or anywhere else, you can still donate tissue. So if your body is taken to a mortuary undertaker, I think they have up to 12 hours for corneas. Corneas restore sight. Skin is vital. Skin, I mean, we've seen kids at Red Cross Children's Hospital who've been so badly burned, and skin, or it's like a gauze that just helps with the repair or the healing process, is so vital for these kids and adults that have been so badly burned. So skin is actually life-saving. And those organs, so it would be cornea, skin, bone, and heart files, can be donated up to 72 hours after death. So that's generally the process that's involved.
Yeah. Well, Sam, you know, we should be in touch because I'd like to donate everything that's usable, particularly because I'm choosing to be cremated. So if somebody can benefit from, you know, whatever I've left that's viable, I'd love to do that. But Executive Director of Operations at the Organ Donor Foundation,